Record.
Thanks, everybody, for joining us today for our Lunch and Learn on the Family Educator Partnership with Karen Thompson from the Ask Resource Center. Karen has worked in disability advocacy, rehabilitative training, counseling, and public program administration, serving people with disabilities for 30 years. She has served as the executive director at Ask since 2010. At Ask, Karen works across all projects at the organization, facilitates board and stakeholder collaborations, and serves on a number of federal and statewide boards and committees representing persons with disabilities and their families in the areas of education, healthcare, and advocacy. She holds a bachelor's in psychology from Nebraska Wesleyan University, and her family experience with disability spans 3 generations. She is the daughter of a massive stroke survivor, the mother of 2 neurodivergent children, and is herself a person with dyslexia. She sees disability as an attribute and challenges others to do the same. Thank you, Karen.
Thanks, Chris. Thank you, Autism Society, for having me here today. And wow, what a great turnout. I see some names of folks that I recognize, and I see a lot of new folks. So I'm glad to be here to present to you today and help clear up some questions and conversations that have been happening on the landscape in Iowa around what it looks like to receive family support under the umbrella of the Iowa Department of Education, as well as the other services and supports at Ask, which actually, as we get going talking about these things, you'll see it's not really that much different from what Ask has always done. It's just a much larger capacity that we can take on now. So I am going to jump right into it because I want to be sure that we have time for questions. And the bio that Chris read gave you all of the information about sort of my story and background. So I don't need to go into that for you. I do want to say, however, that one thing that I think was extremely important in my upbringing in the world of 3 generations of disability is that prior to my father having his stroke, he was one of the ministers in our small town in Nebraska. And the principals from my school all attended our church. And so when I became known as having dyslexia and my parents needed to navigate that world with me, there was already a rich history, a relationship built. It was respectful and trusting between my family and the leadership at the school. And that had a huge impact on my outcomes and the ability for the school and the family to work together and work through differences of opinion from time to time. I entered special education when I was a first grader, a self-contained special education classroom. I was exiting self-contained special education when I was the self-contained classroom as a 3rd grader and exiting special education as a 6th grader. So even though my prognosis back in the day was don't plan to send her to college, because that used to be the prognosis for people with dyslexia. That isn't what ended up happening for me at all. I flourished in school from 7th grade on, went to college. I struggled as a student from time to time, but I wouldn't say any more so than anyone else. And a lot of that had to do with the relationships. So I am so proud to be able to work for an organization now where the main thing that we do is really help families and educators and other professionals work together, be seen as equitable to one another so that the relationships that grow are bidirectional. And because ultimately what's most important is the movement forward for the sake of the child that everybody is working to wrap around. So that brings me to being the executive director for Ask Resource Center. For those who don't know, Ask stands for Access for Special Kids. Back in the day, when it was originally named, that's what it stood for. But today people mostly call us Ask or Ask Resources. And we support families of children with disabilities across the state of Iowa. And those children might be adults. They might be dependent adults. They might not. But they're somebody's child. Somebody is involved as a family member or a caregiver in some way most of the time. So I want to give you some basic background about Ask Resource Center before we get started diving into the buckets of work that we offer. There's a whole lot of words on this slide. This is the entirety of our mission statement. So I am going to read it to you. Ask Resource Center is a family-focused nonprofit organization whose mission is to empower people with disabilities and their family members. We provide individualized support, collaborative advocacy, informational resources and training, and leadership development for Iowa families and caregivers of people with disabilities or special healthcare needs. Ask also provides technical assistance for the professionals who support them. Ask's programs are funded by federal and state grants and by private donations. This is in a nutshell describes exactly what we do and who we provide our services for. So how do we do that? Well, let me tell you a little bit about the history of Ask to give you the foundation that leads to that. We were started by a small group of parents. Actually, the original idea for Ask came from two parents who were out in public. They had their children with them. Their children had fairly significant needs. And the two parents were able to identify each other as family members who had a similar experience in that way. So they began up a conversation with each other, and one of them had background in political organizing, the other one had background in social work. And yet they were talking about how difficult it was for them to navigate the services and supports that they needed for their child or for their children. And that led to a conversation about what about those families who aren't as connected as we are, who aren't as knowledgeable as we are, who aren't willing to speak up like we are. And this was back in the day before cell phones and before the web, or at least at the very beginning of web anyway. And so support group meant we get together in a room. And so that's what Ask originally was a support group here in the Des Moines area. But it quickly grew large enough that they needed to have it be outside of someone's home and in a business. They approached Mercy Hospital and asked for some space, and it grew and grew and grew. It became a resource center. It became known statewide, and was filed for nonprofit status in 1997. In 1998, the first grant was applied for one, and the work began heading forward as the Parent Training and Information Center for the state of Iowa, or what we know as the PTI. So the staff of Ask and the board of Ask have always been, and Ask was created by, people who care for a person with a disability or are a person with a disability or both. And that's the case for parent centers across the country. So when I talk about parent centers, what I mean is the Parent Training and Information Centers, the PTIs, and then a smaller version of that same thing called the Community Parent Resource Centers, or what we know of as CPRCs. And together, the PTIs and the CPRCs make up what is called the Parent Center Network. There is at least one PTI in every state. Some states have more than one. California has more. There is a PTI in every borough in New York, and then the rest of the state has a PTI. Chicago has a PTI. The rest of Illinois has a different PTI, and so on. But in most of our states, there's one PTI that addresses the needs of the entire state. The CPRCs are smaller. They are PTI-like organizations for a particular subsect of the population. So there is a CPRC in Miami for Cuban immigrants. There is a CPRC in the Upper Peninsula for people who are geographically isolated. There's a CPRC on Navajo Nation for the Navajo Nation, and so on. So CPRCs are for specific subgroups of the population. They're typically about 5 to 10 miles in radius in terms of their service area, and they serve about 100,000 people, whereas PTIs serve an entire state or a very large group of the population with many components to it. The point to this is to tell you that, well, a couple of things. One, we're connected to a network of other parent centers who do the same work that we do. Many of us have been around for a long time. It allows us to share resources, do our work very well, very collaboratively, very robustly. And it also allows us a National Technical Assistance Center that we can look to for support, that funnel information out to us. And it's also a way that we connect closely with the Office of Special Education Programs at the U.S. Department of Ed. Another important point here is for you to understand PTIs, the funding for us has never and does not flow through the states. It's a component of the Individuals with Disabilities Education Act for PTIs and CPRCs to exist. And they are purposefully sitting outside of the system. It is seed money. So the PTI grants are smaller grants. CPRCs are even smaller than that. The idea is to give us the foundation and allow us to do the work within our service areas, but then to work collaboratively with state departments and also be contracted with them to do the work to support the families. But because we sit outside of those systems and we are not a pass-through of the system, it allows us to do our work in a fairly objective way. And I'll talk about that a little bit more going forward. I also want to point out there's a lot of information packed into this slide. If you happen to know families who live in other states and they need to know who their PTI is, you see that website there that says parentcenterhub.org. You can go there and there's an interactive map. You can click on it and that will tell you who your PTI is that you need to go to in each state. There is another national network for the F2Fs, the Family to Family Health Information Centers. We are also the F2F for the state of Iowa. It's like a PTI, but it's in the healthcare world. So instead of focusing on things that have to do specifically with special education, we're focused on children and youth with special healthcare needs under F2F. So all things Medicaid and waivers and insurance and diagnosis and treatment and specialty treatments, those kinds of things. And then there's also something called the P2Ps, the parent to parent. That is more of a certification or an affiliate organization. It does not come with funding, but it is the entity that most of us who have statewide mentor networks, we collaborate with and are the affiliates of the P2P to make sure that we also have a national network of centers who provide mentorship support, that we're connected to each other for that, and that we all do that in a unified and research-based kind of way. So you can see that ASK is connected with a lot of different other family support entities across the country, and we utilize their resources in the work that we do every day. So we are still Iowa's Parent Training and Information Center. There's also a new grant now called the RSA, Parent Training and Information Center. RSA stands for Rehabilitative Services Administration. Whole lots of acronyms, again, all in the parent center world. So we are the PTI. We are the Rehabilitative Services PTI, which is a small version of a PTI grant that is used to serve youth. We are the F2F, and we are the P2P affiliate for the state. We have a new partnership as well with the Iowa Department of Education to expand impartial and collaborative coordinated services to families across the state. People have been asking us, so you now have the FEP program, right? So we want to be careful to use a different title for it than that, because the legacy of the FEP is very important. They were around for a long time, 30 years. We interfaced with them regularly. They referred to us, we referred to them. I felt it was by and large a very collaborative and supportive network in the state of Iowa that we had. I know that the Department of Education plans to continue to utilize, especially some of the written informational supports that the FEP created. So that legacy is not going to go away, and we wouldn't want it to. So you're still going to see FEP logo and some documents from them that are listed. So in order to keep there from being any confusion, at ASK, the new contract is referred to as Family Support Services at ASK. And it's that broad on purpose. We really don't want you to think about all of these acronyms and worry about what you need to ask us for. You'll hear us as one of our taglines will say, just ask. we'll figure out which funding source you fit into. Almost every family that contacts us fits into more than one anyway. And we're not going to ask you to work with different people in order to receive the services that you need from Ask. We cross-train all of our family support services folks. So you're not going to have to talk to one person for a health matter and another person for an education matter. When you call in with one contact issue that you have, you're going to have one person who will help you through that whole issue. Now, the next time you call in, it might be a different family support that works with you. And I'll describe a little bit more about what that process looks like here in a minute. But you do not have to worry about what the names of the programs are. Now, as far as family support services at Ask goes, the specific contract with the Iowa Department of Education, we are housed in each of the 9 AEA regions. So I'm sitting in my office right now. It's about maybe 14 by 14. And it's an office for me and other staff members when they're here. There's somebody here with me right now working away. And so that's it as far as the bricks and mortar here in the Des Moines area. Most of our offices are scattered across the state, and they're in-home offices. So these are family support staff and coordinators who have an office at their house. They have their laptop and they travel about their regions, or for the coordinators, they travel across the state, providing the work that we provide. We utilize a team-based approach with coordinated statewide support, and I'll talk to you a little bit more about what that means here in just a minute. And when we say that it's impartial, collaborative family support, we mean a few things there. For one thing, when a family needs to go to a higher level of dispute resolution, such as a statewide complaint or a due process or a state mediation, no longer will the family support person be unable to continue to assist the family at that point. Previously, once you go to that level where it's a legal matter, it's a legal proceeding of some sort, that person now became sitting on the other side of the table. They were part of the party that was opposite the family. That's no longer the case. So Ask will continue to sit beside, help support the family member. The data, we have very, very robust data systems we have to be the federal entity and have been it for so long. But our data systems that go to the department will be in aggregate. So case data is not something that will be shared with the department. If a family files a state complaint or a due process, the education system is not more privy to what the family has shared with us than they ever were before. However, you do need to understand we are not a legal agency. We're not a legal services agency. So although we will help you through the entire process, we do not provide legal advice or any form of legal service. So if you should ever call in and decide that you need one of those higher levels of support, we can talk about that in depth at the time. Okay, so let's go on a little bit more here. The screen just froze. There we go. I call these buckets, the buckets of support that we offer at family at Ask Resource Center in the family support area and in all of our projects include information dissemination, training, mentoring, and then what we call individual assistance, which includes technical assistance to professionals that we might be serving, either because they want to initiate some new product or service themselves in their area or in their organization, or they might be working with a specific family or two and want some support from us. On the other side, the other box that is listed there tells you what some of our products and services are that are most used by families, things that they're looking for. These are not the only supports and services that we offer, but they're some of our most popular. So I'll touch on those as we get going a little bit further into this presentation. Aside from respect training, I'm not going to talk about that much anymore, but I do want to let you know respect training is a dispute resolution training designed for teams, anybody who might serve on an IEP team, on a 504 team, on a behavior planning team, on a health team. We've even had some companies hire us to provide respect training for employment teams. Respect stands, it's an acronym, it stands for recognizing everyone's strengths through peace building, empathizing, communicating, and trust building. Respect is a training curriculum that teaches you what your conflict style is, what other people's conflict styles are, how to recognize that, work with various different people, take what we call the third side, sort of become an informal mediator in a process that might be breaking down due to conflict, and how to walk through conflict and use it in a healthy way, keep the conversation moving forward. It's a highly sought after training. And it is always something that we have been contracted by the Iowa Department of Education to provide. They have, while they're working through their reorganization that they've gone through in the past year, they have decided to discontinue all of their mediation and dispute resolution trainings just for the current cycle or so, while they kind of refigure out exactly how they want everything to look. And so hopefully we'll be back up and going with respect trainings next year. If you get a chance to go to one, try to do that. We can tell when we go to meetings and there's conflict in the room and somebody has been at respect training, we almost always, the family supports will come back to me and say, so-and-so has taken respect training. I can tell. And they're right. We'll go and look on the rosters. And usually if there's a champion in the room helping everything move forward, most of the time they've had respect training. So it's very, very highly useful. And on the evaluations, people talk with us about how useful it is in their personal lives as well. So of course, conflict resolution is a universal strategy and something that most of us aren't naturally good at. We have to practice it. Okay, so let's move on. So that first bucket I talked about is information dissemination. And if you're thinking about this in terms of a pyramid and the types of support that we offer, this is our most universal type of support, that the thing that's across the bottom of the pyramid that we provide to everyone. Because of course, if you have information that you can trust and that is useful and in language that you understand, oftentimes you have what you need to solve your problems yourself. Not always, but a lot of the time. So we create family-focused information. We do that in a lot of different ways. You can see the different types of resources and supports that we offer there. Also, if we find great resources that someone else provided, like someone else in the parent center networks that I talked about across the country, or other organizations or stakeholders that we work with here in Iowa, we won't recreate it. We'll share it out the way that it is. So you will find resources on our website that are ours, and you will find things that belong to other people. You'll also see the Transition Iowa website there. We call that our sister site, and I'll talk about that a little bit more here in a minute. So to get on our newsletter, it goes out about every 2 weeks. And in the footer of our website at askresource.org, you can see our websites right here. You can sign up for the newsletter. It's as easy as put in your name, put in your email address, and hit submit. If you want to come off the newsletter, it's as easy as the next time you get one, hit unsubscribe, and you will stop receiving it. So it's very easy to get on and off of the e-news list. If you have things that you would like us to share out, please send them to us. This is our catch-all. So to the extent that we can share things out that are going on across the state, we do that. Now, sometimes we have literally 20 to 50 things that people want us to put in an e-news, and that would be way too long. So if there happens to be a cycle where we can't fit everything in, you will at least find us sharing it out on our social media. But to the extent possible, we're fitting things into our newsletter. So it's a great way to find information and then share that out with your networks from there. You can pass on the website directly, or you can take it in sections and pass on pieces that you want other folks to know about. A lot of professionals sign up for this, and it's a way that they share information with their families. We want you to do that. That's a great way to build trust with families, and that's the first step. You can also see there all of our contact information. You can contact us any of those ways, but there is also now on that footer another thing that says contact form, click here, or to contact us, click here. And you can also see that there's a tab for that up here. And actually now it says contact us. It used to say contact, but there's a link for that down here now as well. And that's because that's the process we want you to use to reach out to us. I'm going to talk with you a little bit more about that here in just a second. But first, let's talk a little bit more about what that universal tier of information and resources looks like and how you can access a lot of that information. You can go to the resources tab on the website. And one of your options is, oh, where'd my mouse go? Here it is. One of the options is right here. How can we help you? Because there's a large resource library. So there's the how can we help? And if you know what the language is, what the jargon is for the education thing you're looking for, or the healthcare thing you're looking for, you can certainly plug it in there and the resource will likely come up. But for a lot of families, they don't know that jargon or they're not sure what they're looking for. So there's a dual research bar, or dual search bar, I guess I should say. So the first thing you're going to do is click on whichever one of the main categories you're looking for. Once you do that, whoops. Sorry about that. I lost my page. Just a second. Okay, hopefully you guys can all see that page again.
We can, Karen.
Oh goodness, it went back to the beginning. Okay, if you get dizzy when slides progress fast, look away for a second. There we go. Sorry about that. Okay, so once you've clicked on that initial category, so in this case, I've clicked on health, then up comes a listing of subcategories. So here's the subcategories that you can click on within health. And then you can see when I click on health, already all of the health resources come up. But if I were then to click on in an educational setting or in a healthcare setting, it would further filter the long list of resources that are on this page so that you are more likely to get to the thing that you exactly need. Well, my goodness, you guys. I'm just going to make you all kinds of dizzy here. Okay. So one of the most popular things that is on our website are these different types of templates for requesting services from the education system. So you can see what they all are right here. And these are templates. So when you pull up these letters, you then have something that you can write your specifics into. So you can copy it over, use the language, and it kind of guides you what it is that you want to put into that letter. This is also something that we might use with you as we're working with you in family support. And we'll talk about that a little bit more in a minute. Another thing that I wanted you to get a sense for is the top information sheets by search category. So you can see that we're collecting data all over the place all the time. So these are some of the main things in terms of our education and behavior resources that families are looking for. So one that's interesting too, I wanted to be sure you knew that those were available and that we're watching that because that's how we learn what other trainings we might need to provide for families, what other resources we might need to provide for families is by looking at the data and understanding what people are using most. Also, because if this is maybe related to something that you've struggled with, you're not alone. There are a lot of people out there who are searching for the same information that you may have experienced difficulty with at one time or another. And then these are the top info sheets by search category in health and transition. And I'll just sit there just for a second so you can read those. A couple of them have lengthy titles. Okay, so moving on. So if we think of that pyramid again, and we're thinking about that universal tier, the next tier up would be our supplemental tier. So that kind of mid-level tier. So this is where we're providing trainings. The type of training I'm doing for you today is a very universal training. It's high level, it's the basics. We also provide supplemental training. So we might dig a little bit deeper into a specific piece of something. For example, we do universal training on what IEP is, or what IDEA is, or what special education means. Then There are also supplemental trainings that dig more deeply into that. There's a training that we have that is called the 6 Principles of IDEA. So it talks about each of the main pillars to the law. And then you can dive deeply into that. One of those principles is the IEP. So there's a deep dive into IEP. Another one is least restrictive environment, LRE. So you can deeply dive into LRE and so on. So some of our trainings are universal level, some are supplemental level. We provide training through webinar, through in-person across the state. We get invited to things. We create our own trainings for things sometimes around the state. We have some online modules that are sitting there for people to use. We do small and large group settings. And we would be happy to attend things as small as support groups all the way up to large settings if you would like us to share some information on education or on healthcare with the families that you work with. Our YouTube channel is very popular. We do Ask an Expert webinars. They tend to go in series. We do 24 webinars a year. And we typically put them in series of 2 or 3. So in a month's time, you're going to have a topic. It might be, here's an example, early access, early childhood items were one set of a series of Ask an Expert webinars. So we do those for a month, we record them, they go on our YouTube channel, and then you can find them. We take them down when they no longer have relevant information in them. Here's another example. We did a series on what it means to address the benefits with your child who is transitioning. So talked a lot about Iowa Able accounts, what SSI is, how to apply. There's another series after that, how to make sure you don't lose your benefits and all those kinds of things. When you go to the Ask Resource Center YouTube, the easiest way to sort through what's there is to click on the videos tab. Then we also have shorts, and shorts are little 3 to 5 minute long videos that give you just a specific how-to. They might be a splice from one of our larger webinars, and then some of them are created specifically to be a short. You might have seen the one that recently went out on our social media explaining how to figure out where your spot is for a Medicaid waiver and how much longer you have to wait. Okay, and then here's an example of me searching for information about the keynoters for the Together We Can conference. So you can really tailor it down once you're on that site and get right to the videos that you would like to see. Our events tab is where you can go to register for any of our trainings. Our trainings also include currently a virtual support group. That's going to continue for this year under this new contract that we have. And then those staff that are spread across the state, once they get really, really clear on what family support is, and we're sure that they're onboarded well and that they're handling their family cases well, you will start seeing them going to resource fairs in their regions, creating training events in their regions, and holding in-person support groups in their trainings, or sorry, in their regions. So you will see that in about another half a year, those will start to happen. Right now, we're still making sure everyone is onboarded. There is a lot of information to learn to provide professional advocacy in the way that we do at Ask. So for right now, the virtual support groups are still available. They are held once a month. They're typically on a Monday. They're usually the first Monday of the month. Some of those might move around a little bit for the next couple of weeks here. A lot of the folks who used to run these have either taken jobs with other organizations in family support, or they have become the family support services specialists at Ask. So it is typically our mentor network who helps run these, and we are working on training a new cadre of mentors. In the meantime, you might see some staff members running it in the near future. But we like for this to be the mentors as much as possible who run this event. We're there so that we can make sure that the things that are said are factual and we can provide some resources, but we try to sit in the background and let people just network and communicate with each other. So this is really a great way to connect with other families across the state. All right, so I just mentioned mentoring. It is one of our more intensive forms of support that we offer. It is parents, family members, caregivers who help other parents, family members, caregivers with like circumstances as a peer-to-peer resource. It is volunteer. Currently, the mentors do receive a small stipend for the work that they do, but the majority of their work is volunteer. So mentors are trained, but their training is nowhere near as in-depth as our family support services folks are. And their jobs are not the same. They are not meant to provide professional advocacy. They are there to provide basic informational, navigational, and emotional support. So emotional support means sharing a little bit of their own story, listening to the family talk about their story, active listening to help get to what is it that we can help you with that would support you going forward. So that's the emotional piece. Informational means they know our resources well, and they often know the local resources and the other stakeholder resources across the state, so they can connect that parent. Oh, you have a child with autism. Oh, you just received the diagnosis. I see. Yes, I remember when, that first happened for us. They would tell a little bit of their story, and then they would connect that family to people like Autism Society, and other networks and supports that would be helpful for that family. And when we say navigational support, we are talking about making sure that those families know how to navigate to the support that might be provided by an entity like Autism Society, when it's appropriate to reach out to a professional support from ASK, what CHSC is and where the clinics are and how to tap into those. So I don't want people to misunderstand when we use that word navigational. We're not trying to supplant or be what a family navigator is. A family navigator is a position that exists inside child health specialty clinics and oftentimes in other health settings. And they navigate those families with those families for that medical home. We're not trying to do that with mentoring supports either. It would be more, do you understand what this is? Do you know how to connect with them? Here, let me help you connect with them. And then that handoff happens. Our mentors are oftentimes helping a family that's new to something they've walked through before and receiving support at the same time for something that they are about to walk through. So you can be a mentor and receive a mentor at the same time. You don't have to know all, be all in order to be a mentor. The training is typically between 4 and 6 hours long. It goes over things like confidentiality, how to know when to refer, what it's like to active listen, how to help a family treatment plan, when to use your story and when not to, how to help a family member peg what their emotions are at the time and process their way through those emotions and those sorts of things. We have a coordinator who matches a family who has a need with a mentor, and then follows that connection to be sure that it's working. And we use the research-based approaches from Parent to Parent USA to follow that match, make sure that it works the way that it should. After 4 contacts back and forth between the mentor and the family, we typically back out. The idea is to create a grassroots network of families who can support each other. And so we're there kind of following it initially, and then we back out, and hopefully that mentor and that family will stay connected and continue to take on other families in the same way. This is the one service that we don't have very many slides created for yet. So I talked at you a lot just now. And as you see future versions of the same presentation happen, there will be a couple more slides depicting the way the mentor network works and showing you where they are across the state. Now, our most intensive type of support is individual assistance and technical assistance. Individual assistance, these are just kind of federal categories. When you're providing IA, individual assistance, that means to a family member. When you're providing technical assistance, that typically under the realm of the type of grant we're talking about here, we mean we're providing the support to a professional, to maybe an educator or an administrator or a stakeholder. So we might be giving them the information and resources rather than them finding them themselves. We might listen to them, talk to them a little bit and go, here are 5 things that I think you need. But it's also advocacy efforts. So this might be where a family contacts us and says, I'm about to head into my first transition IEP. How is it different and what do I need to prepare for? We can help you with that through individual assistance. It might also be where you come and say, you know, I think I have some pretty big questions and I don't think things are going how I thought they would, and we can help you at that level. And it might also be you call us up and say, wow, things have really kind of fallen off a cliff here and I need a great deal of help and support. I need to understand what my options are, and I may need to take some big steps. And we can help you at that level as well. Again, we are not attorneys, but we will help you understand what your options are, what they each mean. And once you decide what you want to do, we will help you to the extent that we possibly can as professional advocates who do not provide legal support. Like I mentioned at the beginning of the presentation, we serve the whole child. So whether it is a healthcare matter, an education matter, it has to do, maybe you've got 2 things. You need to know something about waivers and you need a behavior intervention plan. And you are not sure what ABA service is and if you should use it. And how does that fit into your IEP and where should it be on there? Maybe you've got a lot of different things like that. And we find that's often the case. Families will call us with a question or 2, but as we talk to them for half an hour, we discover that that's going to go in a bunch of different directions. And so we don't want you to bounce from family support to family support. For the issue that you reach out to us for, you will have one person who supports you. Now, as that issue closes out, let's say a few months down the road, you contact us again. You may or may not receive support from the same person, but they will also have that cross-trainedness about them, and they will have access to the database where the person prior has shared your information, so they can see exactly where that person left off. They can read it, and when they contact you back, they will be able to pick back up again with the issue. If it was something really intensive, it might be that we make sure the same person contacts you back, but that may not always be the case. All right, so that gets us to how you refer to ask. So like I said, this used to say contact and my slide still says that, but now on the website, if you go to this tab, it says contact us. That little nuance and adding it into the footer of our pages seems to have helped many more families understand how to navigate this. And this is the tab you want to go to reach out for any support for ask. So here's what it looks like. When you scroll down the page a little bit, you'll see make a selection. You can talk with a family support specialist. You can request a training presentation, or you can request attendance at a resource or an exhibit fair. Or you could be matched with a mentor or ask what it's like to become a mentor. So when you click on one of these and hit submit, it's going to go into a system that's going to ask you a number of other questions so that when we reach back out to you, we know exactly what you need and the person who reaches out to you has what they need to support you. This is one of the things that's very different from the way the system with the family educator partners looked, but it is not different for Ask. We've been doing this way for a number of years now, and we have found it to be the most cost-effective and the most human resource effective as well. And I'll tell you why. For a while, we had hired a full-time intake specialist to sit on the phone and take the calls from families coming in. But families need to talk for a little bit in order for us to know exactly what the issue is, unless we're asking very specific questions. So she would be on the phone with one family and 6 more calls would come in while she was on the phone. So still, there's 6 people putting their information on a voicemail instead of getting help from us. So we realized that wasn't the most effective way to do that. So we spent a long time working on what each of these sets of questions are behind the scenes. When you ask for family support, you get your set of questions. First, it'll say, are you a family? Are you an individual? Are you a professional? And then it'll skip logic you into very specific questions that are collected in a confidential database. It doesn't go onto an email. It doesn't go out into the web. Your questions get answered. Those answers go into a confidential database. You can also upload documents. So let's say you are talking about an IEP or a behavior plan for your child as you're submitting this form. You can upload those documents to us. Now, the other thing that's a little bit different is when we're working with somebody and they need us boots on the ground, face to face with them, then that is a time when you will most likely be working with the person in your region, but not always, because we have a group of coordinators as well who are content experts. So for example, one of our coordinators works in transition. So you might be working with the family support in your region if you're having a problem with a transition IEP, or it might be the coordinator that we assign to come and do that. In any case, we want it to be in this centralized repository first, so we make the best decision about who to use. And we don't have one staff person in one area who's got 50 calls waiting and somebody else over here doesn't have any. We want to make sure that you get some immediate attention right away. And then if we need to be boots on the ground with you, we'll address that when the time comes. So we want everybody to get used to using this system. This also helps us measure response time for each of these different types of needs. So right now, every month we're looking at this, so we know exactly how long it's taking us to pick up a case and contact that family or contact that professional, and we can track the averages for how long it takes for us to respond to people. So it's very important to us that we do this well for you, and that's why we want you to use this system. Once you do that, there are different welcome letters. So if you ask for one-to-one support, this is the welcome letter that you're going to get. If you're a professional, it looks a little different. If you're asking for a mentor, it looks a little different. But this gives you an opportunity to look for some specific things and begin to prepare so that when we call you, you are ready for the conversation with us. All right. Before I go into post-secondary transition, I don't have a whole lot of time left. I want to see what questions you might have about the referral process and how to use that form before I continue. Any questions about that? Great. Okay. So I'm going to go back to the screen then. All right, so I mentioned that we have a sister site that's called Transition Iowa. Again, the Iowa Department of Education has funded us to work on Transition Iowa for, gosh, I think 5 or 6 years now. So this is a second website that is all things post-secondary transition, living, learning, and working after high school. As you probably know, in the state of Iowa, transition planning starts at age 14. Hopefully it starts sooner than that, but formal planning through the IEP starts at 14. That's 2 years sooner than it is in the federal language. At the federal level, it starts at 16. So kudos to Iowa for doing better than that. But to the extent possible, help us get the message out to all those families that really transition planning starts at 5. So hopefully people are looking at the Transition Iowa site early on. Okay, so I'm going to make sure we move on from that slide. So on Transition Iowa, there is a page that looks like this, and it's an interactive map. When you click on those green signs, it will bring up checklists and information for you to use to help your child move through the transition process in the state. And it helps you know exactly what to do step by step. Here are some of the resources that are on that website. It has over 300 resources, and its resources tab with that dual search bar works exactly like the Ask tab does. Of course, the categories are different. Here, here's a transition planning list first, so you can see what one of those looks like. When you're on that interactive map and you click on high school, This is one of the pages that's going to come up. So you can read who's involved in what it looks like to have your vocational counselor available, what pre-ETS is, skills to pay the bills is one of the trainings that people find most useful at this point. So you can click on some of these things and utilize them to understand how to help your high schooler transition. Here is what is on the resources tab. Here is what is on the assessments and activities tab. And one other thing about Transition Iowa is that unlike the Ask site, where the events tab at Ask is for Ask events, on Transition Iowa, the idea is all things across the state of Iowa. So on the Contact Us form at Transition Iowa, you can submit if you have an activity or something going on around the state that has to do with transition. You can submit that, and we will then put that information on the events tab of the transition site, and the link that says if you want more information, go here, sends them then directly to whatever your site is. So it will leave Transition Iowa and go to the site that is housing that event. So it's a good way to get people connected to other entities around the state and to make sure that we're sharing out information about transition services all across the state. You can also send those through the Ask Resource Center contact us page as well if you want to, or reach out to info@askresource.org. We have the Together We Can conference. It is always the first Saturday in May. It's a conference planned by families for families. We have as many family advocates on the planning team as we have self-advocates on the planning team. There are tracks in the conference for education, disability law, health and wellness, and self-advocacy. So it's a one-day Saturday conference. It's got a huge resource fair, great thing to plan to attend. You can put it on your schedule right now because it's always the first Saturday in May. It's always at the state fairgrounds until we outgrow that site. And so it's a great opportunity to connect with other families. We break records every year. This last year, we had just under 300 families registered to attend. Okay. So first I want to know what questions you have, and then we've got a few minutes left that if I answer all of your questions, I'd love to know how you plan to use what you've learned today, what resources and supports you would like us to produce for you, and what training you would like to see from Ask. I am going to quickly move on to the contact tab so you can see the information. And then I can tell there's one chat. Just to confirm, direct parents to use the website. So it's not a family educator partner, it's a family support specialist. And yes, you would use the website to reach us for one-to-one family support from a family support specialist, or to reach us for a training that you might want or a resource fair in your area, or if you would like to be connected with a mentor or to become a mentor. If you have some other sort of question, you can always use the info@askresource.org, or you can use the phone. Also, those families who, every once in a while, we have a family who may have difficulty filling out the form for one reason or another. It is translated into Spanish, so there's the whole set of forms is also in Spanish for families, but perhaps they speak a different language or maybe have a disability themselves that renders the form not super useful for them. You can always contact us through email or phone, and we can walk you through the process with a translator or an accommodation to make sure we can get you on the list for a callback. You bet, Danielle. Thanks for the question. Any other questions for me? I feel like I talked at you so much. I'm used to doing interactive trainings, and this one is just, it's a sit and get, so. Okay, well, I am going to stop share. And just quickly ask again if anybody has specific things that you would like to see us do. Either info sheets that you need, webinars you want to see, a short you want to see, or specific training you'd like us to provide. An IEP 101 training would be great. Wonderful. Thanks, Dawn. Good to see you, Dawn. Dawn is one of those folks who was super helpful for us in the mentor program and she's working with a stakeholder that we partner with frequently at the University of Iowa with CDD, and doing family support there. I agree with you. IEP training would be very helpful. We're about to release a set of Ask an Expert webinars, and we'll be doing exactly that, talking about IEPs, and then you'll see a lot more coming forth around the state in the next year. Anything else?
Karen, are you getting questions? Are you able to help families who, with the new attendance laws in Iowa that have occupational therapy, speech therapy, different things during the day, and trying to navigate that and how to include that on their IEPs?
We will help to the extent that there is information available from the system as to what that's supposed to look like. So yes, you absolutely can contact us with that. Right now, a lot of people are going, we're not really sure because the guidance hasn't come out yet as to what that's going to look like. But absolutely give us a call. We will help you to the extent that we can. And we are regularly kind of knocking on the door of the department and saying, let us know as soon as guidance comes out so we understand what to tell families to help them with that. We're also looking at a set of Ask an Expert webinars for shortly after the start of the year to address truancy and some of those things.
Wonderful. Thank you.
You bet. All right. Well, thank you
Thank you,
so much for your
everybody. Yeah.
time.
Thanks, Karen. Thanks, everybody, for joining us today. If you do think of a question that you wanted to ask her, you want to ask her without it being in the chat room, you can always just email me as well, and I'll get it to her. And you also have her contact information from that slide as well. So please reach out that way too. Thanks again, Karen. Thanks, everyone, and have a good rest of your afternoon.
Take care, everybody.
To figure out how to stop recording. We have new. Here we go.
There you go. I hit it for you.